The National Unified Health Research Agenda, or NUHRA 2017 to 2022, summarizes the health research and development directions for the country for a 6-year period. It guides researchers, funders, and policymakers on national health research and development to provide evidence-based solutions to pressing health problems. The NUHRA 2017 to 2022 serves as a basis to maximize resource utilization and minimize duplication of research efforts. The NUHRA 2017 to 2022 is developed by the Philippine National Health Research System, or PNHRS. The PNHRS is mandated by the Republic Act 10532 as a national coordinating body for health research. The PNHRS ensures that health research is linked to health system needs and opportunities and to direct investments in health research that will uphold national interest. The NUHRA 2017 to 2022 is envisioned to help the Philippines in becoming a hub for health research that can improve services in the country while at the same time generate products and services that are globally competitive. The development of the NUHRA 2017 to 2022 was possible through the combined efforts of various teams of researchers, academics, government officials, health professionals, and health policy experts all over the country. This was spearheaded by the PNHRS Research Agenda Committee in consultation with 4 core agencies: the Department of Health, the Department of Science and Technology, PCHRD, the Commission on Higher Education, the University of the Philippines Manila National Institutes of Health. Following the PNHRS guidelines for health research prioritization, the NUHRA 2017 to 2022 was envisioned to be inclusive, realistic, and collaborative. In framing the research context for every region and at the national level, several reports and papers were developed that provided stakeholders with an objective basis and baseline information for determining health research priorities alongside national and regional policies and political priorities. Before regional and national consultations were done, each region developed a regional situational report describing the stakeholders, health research context, and the health challenges, issues, gaps, and threats within the region. 4 technical papers were also developed to provide the current research context, the status of the Philippine health research, and policies of government and multinational agencies based on published data, reports, and other documents. The following documents were also reviewed and taken into consideration: the Philippine Health Agenda 2016 to 2022, Ambisyon Natin 2040, DOH Philippine Medium-Term Research Agenda, the DOST Harmonized Research Agenda, the Philippine Development Plan 2017 to 2022, the United Nations Sustainable Development Goals. Regional consultations were conducted with stakeholders from the academe, government, hospital, non-government organization sector, and private sectors with the objective of defining health needs and concurrent research priorities of each institution. Research priorities from all 17 regions were processed concurrently with the research priorities of DOH and DOST via thematic analysis. The national consultation was attended by a total of 50 stakeholders who proposed additional research topics according to their institutional research priorities. The NUHRA 2017 to 2022 incorporated and synthesized the regional research topics and research priorities of PNHRS core agencies and national stakeholders. A total of 43 research areas were identified and grouped under 6 themes, which comprise the health research priorities of the country for the period of 2017 to 2022. The research themes are: researches for responsive health systems aim to produce evidence towards efficient, quality, safe, and affordable healthcare. Researches to enhance and extend healthy lives aim to produce evidence towards the prevention of disease, restoration of well-being, and reduction of disease burden. Researches for holistic approaches to health and wellness aim to produce evidence geared towards the application and recognition of traditional, sociocultural, and alternative approaches to health in addressing health system gaps. Researches for health resiliency aim to improve the ability of the country's health system to be resilient with respect to emerging global and domestic threats. Researches shall be geared towards global competitiveness and innovation in health, aiming to promote research as a tool for creating novel solutions to existing and emerging health problems through technology development and innovation in fields of rapid advancement. Research for equity in health research aim to produce evidence to enable the health system to respond to the health needs of and develop new solutions for vulnerable populations in marginalized sectors of society. The NUHRA 2017 to 2022 will be disseminated and made available as a booklet and will include details on how it was developed and descriptions of corresponding topics for each research theme. The booklet will be made available for download in the coming weeks through the following websites: www.healthresearch.ph and www.pchrd.dost.gov.ph.